Hi, I'm Lauren Masi, Doctor of Physical Therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how pain can transfer from one body part to another. So I'm sure we all remember that song, the foot bone's connected to the shin bone, and on up the chain. So yes, our skeleton is certainly all connected. We also have a thin connective tissue called fascia, which does connect everything from our bones and muscles even to our internal organs. So any stresses in one area certainly can relay issues in another that can be felt as pain or tightness to a patient. Now, as a physical therapist, I will say we can easily be tricked because a patient might come in and report pain in one area of the body, but it's coming from a completely different area. Or a patient's ignored it long enough that now the patient's compensating and those compensations are causing a pain in a different area. So our job is always to get to the root cause of the pain. And one of the ways that we do that is by looking at the joints above and below to start with from where a patient reports their pain. Now, tightness in one area can certainly create a domino effect. So a small pain or issue, even down in your toe, for example, an ingrown toenail, it doesn't even have to be an orthopedic problem, could be affecting how you walk because it hurts and maybe it's bumping into the front of your shoe and you start walking a little bit funny. And then that's going to translate forces differently up through your knee, your hip, even into your lower back. And as your body is not used to moving in these different ways because of said other pain, you might start to experience tightness through the fascial system, through the muscular system. And I've had patients who have headaches that are caused by maybe it's an ingrown toenail, but maybe it's a stiff arthritic big toe joint, for example. So we have to look at the whole person and see how it is all connected. Also, we have to realize that you need strength and flexibility throughout the body. So in some areas, you might need to work on more strengthening, where others, we might need to give you some stretches. We want to make sure that the whole system can work in a nice balance where everything is used equally and we're not adding stresses or strains in one particular area. Sometimes if left untreated, that pain could stay with you for a long time and affect other areas of the body, which could lead to arthritis and future problems. So as I always say, if you start to notice something isn't moving as well as it used to, you're not as strong as you used to be in a particular area, or if you're having pain, you definitely want to act on it sooner rather than later so that these compensations don't trickle through the body and lead to longer lasting problems. If you need any help making sure that your movement system is as efficient and effective as it should be, please reach out today to Bay Area Physical Therapy. If you would like some more information on fascia, as I mentioned in this video, please check out our other blogs on fascia as well as our blog on scar tissue. Thank you.